Hello, everybody. Welcome to Drat and Drake. Today, I have another guest with me. Unfortunately, for starters, I have to say, Dr. Drake, or Remy, he's sick today, so he's not able to join us for the podcast. But everyone, we wish him, hopefully his voice comes back and he feels better. It's too bad. Today, our guest, Dr. Kat Van Zant, isn't able to meet him. But she is someone who I've known for a while as well. A lot of these are guests of friends of mine that I like to bring on. A Ross University alumni with me. From what you told me, you ended up, once COVID hit, essentially, you ended up moving on to relief, GP
Yeah.
relief. And since then, you've been
Yeah.
doing that.
Mhm.
In 2022, you started training for holistic medicine at the
Yes.
Chi Institute. You even did an internship at Davis, UC Davis, for that,
Yeah.
and you've been certified since. Did
Yeah.
I get everything? Is that pretty much
Yeah.
sums up the story? Okay.
Yeah.
Um,
Absolutely.
of course, you can find her on social media, which again, we'll have a plug at the very end. Otherwise, tell me, how has life been treating you?
Life's been pretty great. It's been a wild ride living in Los Angeles, California. The amount of people that I'm meeting and the what they call it, the scene, that Hollywood scene has been incredible, whether it's
Okay.
whether it's my clients or friends by proxy. That's been interesting. I'm not really into pop culture, but
Hmm.
it's just really fun to meet people that you've seen while you're watching TV or listening to music. It's
Fair.
kind of
What
fun.
celebrities have you run into in LA? In LA?
I can't, as far as like clients go, I can't really say. The others, I don't know. My friends just point out, hey, that's someone famous over there.
Probably better to not really know.
Yeah, and I think it helps too when they're my clients that I don't know who they are until they leave.
Fair. Fair.
It keeps the conversation honest and
Asking for
professional.
autographs and photos and selfies.
Yeah, but I always have a weird plan in my head, and then I get
Mm,
shy and I
yeah.
forget.
No.
So,
I bet there's probably people you're working with them and you're thinking, this person is too attractive to not be famous.
oh,
You're right.
yes, usually very beautiful, groomed, and they just have this air about them. You
Hmm.
just,
Hmm.
yeah,
They just know that there's a
and
camera on them all the time.
yeah, trying to learn from them.
Now, I have a question in terms of just overall living in LA. I've
Mhm.
seen, of course, like on my social media, you'll see people almost making fun of people in the social media scene. They'll like film, and you just have dozens of social media influencers doing selfies on their phone to obviously create content.
Yeah.
Is that truly what you see a lot in LA? Is that the majority of what's out there?
From my perspective, no, I don't see a lot of
Okay.
people doing the influencers in the wild,
Yeah, okay.
but there is a place called 1600 and Vine where big content creators, influencers live, and it does
Hmm.
happen right
Okay.
there. But for me, I don't see it. When I film out in public, it's usually just me that's doing
Okay.
it and not six other people.
Here, let's move on to actually the holistic aspect. And can you
Yeah.
told me that you started your training a couple years ago, and when
Mhm.
you told me that you did an internship at UC Davis, I didn't even know that there was an internship available. Of course, this is just because of my pure ignorance, and I know many of the listeners might already know. But for those who are again unaware like me, can you tell me more about the process of how you got certified and your overall training?
Yeah. So gosh, I believe it's a 10-month program, and it's a lot of self-study at home, and then you go down to Florida twice for clinical skills and
Mm,
also to take quizzes
mm,
and to just test your knowledge and make sure you're staying up to speed. And while you're studying at home, you also have to take quizzes too. So
mm.
I want to say I studied over 100+ hours to learn acupuncture. We read it was basically internal medicine 101 all over again,
Hmm.
and
Okay.
and pharmacology as
Huh.
well, and anatomy. I hate pharmacology, so that was a little tough to get through, but
I don't think anyone likes pharmacology.
no.
Yeah.
So as we were learning online, we have to apply this. They encourage us to apply the skills while in the clinics while we're training. So we can start learning how to place needles and how to work with pain management as well. That's where I felt comfortable because I didn't want to do any internal medicine treatments. At the very end of the program, you take a 3 hour long exam to
Mm,
pass to get your certification. You also have to write a research paper, a clinical study research paper of a patient you treated. It's 5 pages. And then you also have to do 40 hours of internship.
okay,
So it's
and
really intensive.
that's where you went to Davis. Now, when you say
Mhm.
the needles that you were working with, I'm assuming is that acupuncture
Oh,
or
yes.
okay. What can you then tell me what encompasses homeopathic care or veterinary holistic medicine? Is it a general umbrella term where you're using non-Western medications? Does it have to include acupuncture? When someone is a holistic vet, what are the expectations that people should have?
Oh, that's a great question because we're still constantly trying to define that and make it more accessible for our clients. One term I heard recently was that we're essentially functional medicine doctors,
Hmm.
if that helps. And I
Okay.
know we do that as general practitioners on the Western side, but we also have these other modalities to treat.
Okay.
Did I answer
Very
your
cool.
question?
No, you did. Yeah.
Okay.
I always, again, we've known each other for a while, and I used to have Asian nights over at Ross
Yeah,
just because we
so
have to
cool.
represent, right? And we
Yeah.
talked a lot about kind of representation and just our backgrounds. And I think whenever I think about holistic, I always tie in with Eastern medicine
Yeah.
and with my upbringing. And I've mentioned this before in the podcast too. And I think you say when you say functional long-term management care, I think that's how I always perceive it. There's definitely a place for both sides, right? When you're talking about treating a broken bone, I would refer to a surgeon to or for TPLO or not in front, obviously for a broken ligament, but for something like that, when it comes to, I guess, more management with long-term care, and now you could say for diet, for GI illnesses,
Yeah.
for arthritis, then
Hmm.
that definitely is that you can definitely work with a holistic vet who can help manage that. Is that kind of
Yeah.
a good way to see that?
Yeah, absolutely. And also, we're second opinion for Cushing's disease for clients that don't want their pet to be on Western medicine. And then they come to us, and we do the same thing with herbs and acupuncture. And then we do a lot of palliative end of life care, and we work with oncologists as
Okay,
well.
that's cool.
Yeah.
Yeah, how is the acceptance overall from your experience? I know it's been about 3 years with when you say oncologist, right? I have this mentality sometimes there's a hierarchy of certain vets and their perception of things, and we have a
Yeah.
chip on our shoulder being island vets. But when you introduce a foreign concept like Eastern or holistic medicine, someone like an oncologist or even an internal medicine doctor, how has the reception for your study been?
I actually have an oncologist out here that is really open to our
Cool.
field. And she doesn't necessarily refer excuse me, clients to us, but she's open to her patients working with us and doesn't tell them to stop. We have a couple doctors that say it might work, it might not, but she actually believes in it. There's an
Nice.
oncologist that we work with, Dr. Trina Hazza, is really big in the veterinary cannabis society field, and she does a lot of studies for THC and CBD in patients, a specialist in our field, which is really cool to see.
Yeah. Yeah, CBD technically it's just because I've it's been introduced to me in more Western
Mhm.
civilization, but I guess CBD would also be definitely be one that holistic vets
And
super
we
cool.
can't legally prescribe it, right? Because it's controlled.
Yes. We can
Uh,
legally
Um,
talk about it.
yes,
Yeah.
about time.
Yeah.
So, yeah, that's been a nice change.
Okay. Can you tell me about your transition from general practice and kind of what inspired you to enter into holistic medicine?
Yeah, thanks. So, I don't know if you remember, but I was in the Integrative Veterinary Club at Ross
Okay.
for while I was down there. So, I've always been really interested in it.
Hmm.
And throughout my life for myself, whenever I'm sick, I have a specific soup that I cook for myself. So I've always been a big believer that medicine is your food.
Hmm.
And going through veterinary school, that's not something we were really taught, except for some of the prescription foods. And so I just kept thinking there's got to be a different modality other than what we do in Western medicine that I can offer for my patients. And I also really like rehabilitation. And so acupuncture and rehab went hand in hand. And then when I dove into the world of Chi University, my eyes were wide open and to all the different things that I can do as an Eastern or holistic medicine doctor.
Yeah. You're telling me too that some options, of course, particularly where you are, there's a lot of holistic vets will be mobile doctors. You also
Hmm.
mentioned that some of your colleagues will actually work at specialty ER hospitals, particularly in their rehab facility.
Yes. Yeah.
What other options, once you get certified, what other options can you have?
Ah, that's a great question. You can work in a clinic and just be integrative only,
Hmm.
and you can just offer those services and instead of doing the typical surgery, x-rays. We always do lab work, right? You
Mhm.
want to know what's going on underneath. The other modalities you can go into doing telehealth for a lot of your patients.
That's a
Yeah.
pretty fair list. Okay. Really,
Yeah.
much like all other specialty practices or even general practices, you have a lot of the same methods of practice.
We want to practice gold standard care, and we always want our patients to come in with updated lab work, x-rays, records, at least at my clinic.
Yeah. Now, if let's say there is a veterinarian who is trying to find a referral or just to get more information about holistic medicine, are there any good
Mhm.
online sources or books that they can get a little more information on the topic?
Yeah, so there is a great resource called the American Academy of Veterinary Acupuncture. It is a resource for people interested in getting certified in acupuncture, looking for veterinarians that are
Hmm.
certified as well, and it has different webinars for you. And I believe they have a list of the different schools that you can become certified at. Also, if you're interested in it,
And you said the main mecca is going to be in South Florida, right?
I have a special place in my heart for Chi University, but there are a couple other programs
So it's a
out there too.
bias.
Yeah, yeah, sorry. Yeah, there's definitely, I'm definitely biased about Chi, but there's IVAS, and I
Okay.
believe it's offered out of Colorado State.
Okay. Yeah, I think cheese, I'm the most familiar with that too, maybe just because based on proximity of where we went to school,
Mhm.
I've heard of it more. So when you mentioned that, I guess I just assumed that it was the biggest and most well known. Yeah.
Yeah, it is the biggest, but some people have a hard time thinking about medicine and from an Eastern standpoint.
Hmm.
So they moved to a different program that blends Western and Eastern.
Fair,
So
fair.
it's really up to you and how you want to learn. But at the end of the day, it's the same thing.
So how long have you had your mobile practice now?
I've had my mobile practice actually since last fall. It's very slowly building, but
Yeah.
it's there. So I'm hoping through social media and speaking with clients, I can build my clientele.
Okay. And of
Yeah.
course, we're going to get into the social media aspect of it. So is the main purpose of your branding online is really to help promote and advertise for your mobile practice?
It's one of the very few facets of why I started it. I have a long list of why I became a content creator, but that's definitely one of them.
Okay. What are some of the differences between a mobile practice and working in a brick and mortar? Are there any challenges that you've been facing?
Yeah, so being in someone's home, you get to know them really well, and they almost become like a friend. So it's hard to have that barrier of I'm still professional. Yes, I'm
Fair.
your friend, but this is a professional relationship.
Hmm.
Sometimes homes are a little gross, so you have to learn how to be
Sometimes.
professional in that. Yeah, I've been in some pretty bad ones.
Oh, I
So you
bet.
have to find a way, a work around that. I do find that my patients are really relaxed in that environment, even my aggressive ones, because
Hmm.
even though they're aggressive, it's just more so they're guarding their home. And once they realize they can relax into it, they're fine.
Yeah. To
Mhm.
bring in, of course, my wife and her expertise,
Huh.
she would definitely argue the same. In a veterinary hospital, in a foreign location, pets are much more stressed. In their own home environment, they can definitely relax a lot more. So I'm happy to hear it's been the case for you.
Yeah,
Yeah.
it's very nice.
Have you been able, do you typically need like an assistant or a nurse to come with you, or are you going solo in these
Right now I'm going solo.
Okay.
So I just have the owners hold who usually set up a little space for the pet and the
Hmm.
owners give them treats, or some patients love it and they lay there and let me place the points and then they fall asleep.
Oh, is it mostly acupuncture that you'll be doing, or are there other treatments or consults that you'll be doing there?
I just do acupuncture. Eventually I'd like to offer laser therapy, in-house
Mm,
rehab. I do also prescribe medication and
okay.
herbs for my patients.
Okay. Are there times when you're doing mobile practices, and of course they call you for more of that holistic approach? Are there times when you'll have to turn on the Western brain and consult with them under those practices?
I think my Western brain is always turned on, so I
Mm,
speak to clients from both angles at all times.
nice. You bring up a really interesting point of the having both sides constantly on and that balance. I can imagine just as human beings, all vets are going to have one sway or one direction or the other, right? Now, one, have you seen vets who really favor heavily onto the eastern side? And two, how are you able to keep yourself in check on both ends and keep a good balance between the two?
Yeah, that's a really good question. I definitely have some colleagues that are full Eastern, very against Western medicine, which
Mm,
is not, I wouldn't say against, but if there's an alternative way or Eastern medicine way to do it, they will 100% go
mm,
all in on that first before
okay.
they do Western, to the point of working on things like ear infections prior to doing Western medicine. But for myself, I like to think of Western medicine as putting out the fire first. So we
Mm,
have to do the big things first. Get that infection down, get that inflammation down, and then work at the root of the problem of the why with Eastern.
okay.
There's, yeah, so
I love
that's
that.
how I like to practice.
Okay.
Yeah.
So Western is putting out the fire, Eastern is preventing the fire.
Yes.
Okay.
Yeah.
Okay. Super,
I'm going to
super cool.
steal that. I like that.
Hey, no, that's
Preventing
yours.
the fire.
Please take it. I'll quote you on it. Yeah. I might even have that as our title tag for the podcast
Ah,
episode.
I love
Yeah.
that.
Here, let's kind of segue into the whole social media aspect because I think this
Sure.
is a big part. We both talked about how we're a little bit older in not so much like in terms of
Yeah.
veterinarians, but just in terms of social media parts. Obviously, I have
Yeah.
my podcast. I've been seeing you making some posts definitely in the last year. How, tell me about that.
Oh gosh. I just I follow a lot of content creators that are veterinarians, and I was just really impressed about the way they could deliver pertinent information for clients slash pet parents in a funny, educational way. And I
Yeah.
really liked it. Um, on the flip side, I also got really frustrated with influencers that were influencing my patients to do the wrong thing, like
Yeah.
eating the wrong foods. It is was my biggest draw. And I thought, heck, I want to try this. This looks fun. I like to be creative, and I wanted to deliver some fun moments for clients to come to and give them a safe space to chat about pet nutrition. That was my segue in was pet nutrition, but
Mm.
now it's expanded into other tips. But that's how it all started. I have definitely imposter syndrome because I'm older.
It's
I
funny.
even had my yes.
No, you said how it looked fun, and then when you get into it, it's like, oh, this is a whole process, a whole another career.
Yeah, absolutely. Which I think is really fun. It's been interesting to see how social media has evolved because I remember when Instagram came out and I'm dating myself. It was just You just snap a picture of something cool you're
I
doing,
know.
put a little title on it,
Filter.
and that's it. Yeah.
I look
Yeah, I
back and
think
I
I
scroll on my photos. It's pretty bad.
it's yeah, it is bad, but the evolution's fun to see. And I just think it's been really neat. And I'm so thankful for the pioneers that did this to make social media a way to spread information and another way to monetize
Yeah,
uh, your information, your knowledge, which is cool.
definitely. I would say timing for us, I think that the social media influencing, especially in the veterinary field, really
Mhm.
boomed during COVID. But for us in particular, you look at a lot of our colleagues, Dr. Z, who's one of our classmates, he definitely made a huge presence
Yeah.
among many others. I think before COVID, the only one on social media that we really knew of was maybe like Dr. Evan Anton and maybe Dr. Annie
Yeah.
Rourke. I think those are the only
Uh-huh.
three. Now we
Yeah.
have hundreds of
Yes.
social media influencers. So
Yeah.
it's been pretty inspirational.
Yeah, absolutely. I'm so proud of us for
Yeah,
doing it because a
let's
lot of
go.
people think that I get told a lot, you don't look like a veterinarian. Like, what am I supposed to look like? Like hay in my hair or like farm wear? I don't
Yeah,
know. It's just such a weird comment to get. So
that is weird.
I'm glad that people get to see us in a different light. Eh,
We
Very
got to represent
diverse.
ourselves. Yeah.
Yeah,
Yeah.
exactly.
No, I
Happy
really like
AAPI.
happy AAPI. I really like your approach. I think that your background and your interest in tackling this presence on our social media is great just because you, with your holistic background, there's essentially a lifestyle, right? So
Yes.
you're not only able to have the legitimacy of having a degree, but with the certification of this Eastern and lifestyle type of medicine. Again, you mentioned diet, which for me personally has been a huge part of my own personal life in the last couple of years. But you can not just talk about that, but everything else in between. You mentioned herbs and roots, but you can go definitely beyond that just based with your current background.
Yeah, absolutely. It is definitely a lifestyle choice because if I can't live it, I don't feel like I can actually practice it, if that makes
Hmm.
sense.
Hmm.
Yeah.
What are some of the demons of social media? What the toxic parts of trying to be present on this platform?
Oh my gosh. I feel like I'm in high school again. I'm not going to lie.
Yeah, yeah,
About caring about what I look like.
yeah.
Um,
Fair.
I'm pretty laid back, but I'm a little bit, everyone's a little vain, but I think my vanity has turned up just a little bit. So that's one. The other is constantly worrying about, oh, my followers like this. Will I get more followers with this? Will I get more exposure? How can I reach more people? And I always have to just remember my true north is people will come to me that are meant to come to me because I'm providing information they want to hear. It comes down to what kind of community do I want to build? I also want to work with my followers, and essentially they're my friends, right? Like my
Yeah.
friends and followers on
Mhm.
socials, because I want them to enjoy the content, but I also don't want it to make my decisions for me and at the end of the day.
Yeah. I think that's a really great response. Now, when you talk about the vanity, do you think that's truly something that is generated? Is you think it's a legitimate concern, or do you think it's something that's in the back of your mind and you're just comparing what you think people actually care about?
I think it's more me.
Yeah.
That's I reference. I feel like I'm in high school again because you're so in your head in high school.
Oh, yeah.
Yeah.
I I
But
I see what you're saying. I think it's a little bit of both, right? Because for me too,
oh
I'm
yeah,
constantly so self-conscious about how I appear like physically, but
sure.
then
Yeah.
when I absorb content, think people who are attractive are the ones who I also will look at more, right?
Oh yeah,
It's
that's true. We are humans at the end of the day. If we think something's pretty or handsome, we pay attention a little bit more,
yeah.
definitely.
Now, I want to get into your strategies of
Oh, yeah.
how, and when I say strategies, it might not be what you're thinking, because when it comes to creating, let's say, like reels or TikTok videos, right? There's a whole psychology behind each video. I think I've seen a lot of people talk about. You have to constantly be doing something in the background. If you're just standing there and talking a lot of the times,
Mhm.
the attention span is only like 6 seconds. So
Yeah.
what I've heard is people have to keep changing up activities or what they're visualizing on top of what you're
Mhm.
saying. And I've actually seen an evolution in how you've done your videos. I know in the
Okay.
beginning you were talking, and then there was some videos where
Yeah.
you actually started entering the scene while talking, and there was a lot more
Yeah.
activity. Can you tell me about how this came about and where you've learned these methods?
Oh, yeah. I got less shy. That's when
Okay,
I started moving more. And just getting comfortable in my own skin and being on camera was
fair.
what helped with that. I have friends in the social media space that I reached out to and asked about some tips
Mm,
on how I can improve my video. So I'm constantly learning from them and reaching out for mentorship. I don't have any specific podcasts or YouTubes that I follow, but
okay,
it's just more of mentorship of people in the online space that I had
fair.
asked from some friends.
I mean, I want to
Yeah,
dig
okay.
deeper a little bit. I'm
Oh,
curious to know what are some of the things that you've learned in this last year? What are the key points? Let's say there's a new graduate who wants to also just jump into this, and they came up to
sure.
you, Dr. Van Zandt, like, how do I get started? How can I make my content better? What's on my device that you've learned that you would also share to them?
Oh, yeah. Okay. Yeah. So some things that I've learned too is there are specific hashtags that you want to look into. So if you
Hmm.
have a small amount of followers, you want to have less than 1 million tags. So there's a hashtag, say I want to do hashtag VetMed, and I plug that into Instagram or TikTok. If it has 5 million views at someone with my account size of 800 followers ish, I'm going to get lost in the feed. But if I do less than a
Oh,
million, I'm going to pop up on the For You feed. So there's a specific strategy for the hashtags for that. And then you have to figure out how many days do you really want to post? Do you want to do it 5 days? Do you want to do it only 3 days? And you'll start, once you post for a couple months, Instagram and TikTok will give you analytics on the time that people are actually looking at you and for how long and what's hitting. So that's where you start really honing in on your followers and what they're diving in on. My specific times are at 3 p.m. and 6 p.m. That's when I like to post because that's when I'm guessing the people that I follow, they're getting bored at work or they're getting off work and that's when they're hopping on and looking
interesting.
at me.
Okay. That's okay. So going back to the hashtag. Um,
Yeah.
so for example, let's say because that goes into you want an appropriate hashtag, right? Because if you do one that's so
Mhm.
nuanced, it might not be relatable to what the person's interested in. So could you give
Yeah.
me an example of one hashtag that would be suitable for your what you're trying to promote, but under the 1 million mark?
Oh, yeah. I actually have it saved on my phone. I
Sweet,
keep it
yeah.
in my. So let's get in here. So yeah, at the beginning, this was last year before I had someone that helped me manage my content. I did
Mhm.
this all self-research, but they helped me get to it. Okay. So one that's good for me is hashtag veterinarian life. So
Oh,
that's less than 1 million. So I have a list of over 30 plus hashtags that I have personally researched and plugged into Instagram to make sure it's less than 1 million views or tags to make sure it
super
fits me.
cool. Okay.
Mhm.
Now, videos have you launched so far that are the most successful? Have you noticed a trend in what type of things you release?
Yeah, the interestingly, my Christmas videos with my cat has been hitting lately. I don't know why, because Christmas was so long ago. But that's been getting more views, like 3 hours plus of watch time recently is what
Wow.
I got on one of them. So a lot of followers seem to like that.
Yeah, for the most part.
So that's been gaining a following. I stopped posting for a while, so I can't really
Mm.
speak to anything recent because I'm going through a rebrand. So
That's a great
hopefully,
segue. Can you tell me more about this rebrand? What triggered this? Was this something where you mentioned that you have a manager for this, who, of course,
yeah.
is known in the community? Was it more of when you were doing this yourself, it was a burnout, this kind of uncertainty of what's happening, and of course, life happens, so you fizzled out,
Mhm.
and now you have a new surge in inspiration. Tell me more about this.
Yeah, so when I was posting myself and comparing myself to other famous vet influencers and lifestyle influencers, actually, my content was not even close to what they're doing as far as the editing, the
Hmm.
quality of the video. The message was there, but everything else just seemed really subpar. And I really wanted to level up and be serious about my content creation. So I took a step back for the past 2.5 months now and really fine tuning what's my color scheme? What do I really want to deliver? And who do I want to deliver to? And how do I want to look? How do I want to present myself on camera? So we've been working on that. We've also been rebuilding my website as well. So we're just really diving in and building my business from the inside out.
Okay. So were you using the management company prior, or you only
No,
started recently?
I just started recently, last summer. It
I
was last
think
summer when I
that's,
started content creation.
yep, I
I
think
took it more
so.
seriously. And
Hmm.
then last fall, I started building a website with my cousin. And that took many months to work on to build that website. And then I totally scrapped it before it launched because it
Oh,
didn't fit my rebrand.
okay.
So my cousin was very, very okay with
Uh,
that. He was so nice about
yeah,
it. So
yeah, yeah.
yeah, he
It
understands.
happens. It happens.
Yeah.
Can you tell me more about this rebrand in terms of what you're trying to represent, your goals, your aspirations?
Oh, yeah. I want to reach more pet parents and
Mm.
talk about our field and holistic medicine because a lot of people really understand what this involves and how incredibly powerful this modality of medicine can be. And I want clients to have access to that information without having to travel to California to talk to me about it. They just have me right there in the phone to learn
Fair.
about it. That's one aspect. The other is I want colleagues and people not in the vet field just have a good time. Look at all the fun things that I'm doing on this side. I like to travel. I like to eat delicious food.
Mm.
I really like fashion and beauty, even though I'm pretty laid back, but it is a small passion of mine. So I like to share those loves as well. I just want people to see that I am a veterinarian. I am so much more than that. And I think that's important for the field too, that we just aren't just one thing. Being a doctor isn't just us. So
Yeah.
I like to share that.
Okay. You've
Mhm.
encapsulated why I made this podcast to begin with. It was just about our humanity and
Yeah,
who we really are outside of this.
yeah.
That's great
That's
to
a
hear. So,
beautiful way to put that.
yeah. So food, lifestyle in terms of, you said fashion, so clothes, and then at the
Mhm.
same time, you're going to mention, of course, holistic medicine and
Yeah.
veterinary diet. Okay. You also mentioned diet earlier, correct?
Yes, yeah.
Okay.
So that's where food comes in. I'll talk about food I
Mm,
eat for myself for longevity. Biohacking is the new hot term right now.
okay. Okay. I've come across
Um,
Ozempic. That's the huge thing that keeps showing up on my newsfeed, isn't? But
yeah, I know, me too. There must be a lot of people looking at it in your news
yeah,
feed. You're getting
jeez.
targeted.
Now, how often, based on your strategies with your team, how often you said you're going to post around 3 or 6 o'clock? Have you decided how many posts you're going to do a week or day or whatnot?
3 days a week.
Week. Okay.
Yeah, I think that's all I can manage. And then
Fair.
it fits nicely into my strategy of I'll do one tip per week for pet parents, and
Okay.
then I'll rope those into my newsletter too. No, because you can only write so much on Instagram, so it's just it would be a quick hot tip, and then
Fair.
I'll dive a little bit deeper into the science of the newsletter. So you have
Okay.
to read the newsletter to get the full info.
Nice. And each of these are, I would imagine the three posts, is it primarily the text or is it going to be video recordings?
So
Okay.
another part of the strategy is we have to fix my grid. So I need to push all of the older videos
Down.
down and get all my new content up. And then, so that for the next couple months, I'll just be doing Instagram posts and
Mhm.
pictures and some stories. And then I'm going to hop back on TikTok to do short form videos too. Those are
Yeah.
fun. I miss doing TikTok videos, but I need my Instagram to look a little bit better before.
Are you in charge of editing and formatting those posts on Instagram? And so you have the whole team helps you out with it.
Yeah, they do
That's
because
cool.
if anyone is looks at my stuff, my old stuff, it's pretty bad.
If you
My
looked at
editing skills,
if you looked at the podcast Instagram, you'd be able to see it's pretty, yeah. There's
yeah.
it's self-managed for sure.
Yeah, I'm definitely an amateur. So that was the main reason I wanted to have someone help me make it more cohesive. But I take all the pictures, I write all the captions,
Okay.
I do all the tags and
Mhm.
everything else that goes along with it
Of
too.
course.
So it's just they're just editing my pictures and nothing
Yeah.
else. And I'm responding to everyone. So I don't have anyone
Oh
responding to
yeah,
me.
and I would. I'm glad you clarified that. I assume that. I take it in terms of a programming aspect. You do essentially all the back end and the code. They're just the one who pretties up and packages everything nicely, right? They're
Yes.
the
Yeah,
user
they're on
interface, the experience. Yeah.
it. Yeah.
Okay, great. I really wish the best of luck with you on that. Here, can you go ahead and tell the audience your website, where to find you on Instagram and social media?
And thank you so much for this. This has
Yeah.
been great. My website is zenpethealth.com. And there you can find a little bit more information about myself and what I do. And you can sign up for my newsletter there. There'll also be a link in my Instagram bio. My Instagram is Cat Van Zant Official. And then my TikTok is Cat Van Zant.
Awesome. I'll post everything on the links below. Anybody on YouTube and also all your podcast locations. Before we get out of here, let's do our sarcoma.
Oh,
Yeah.
yes. Okay. I
Okay.
love that. It's so
Okay.
good.
Oh, thank you. Now, I have an OMA. I have to still think of a
Yeah.
sarcoma because life has been so positive. What can I possibly complain about?
Yeah.
Do you have anything ready?
Please go first.
Okay.
Yeah.
I'll do my OMA, and then you could do your OMA,
Okay.
and then your sarcoma, and then I'll finish with my sarcoma. Okay.
Okay.
All right.
Okay.
This is a little silly, a very nuanced thing, but again, I was mentioning a lot about diet recently.
Yeah.
And the last month, I've been like, okay, let's just go into really strict macros. Not so much because I'm trying to go crazy with counting things and damage my mental health with it. I just really wanted to have an
Yeah.
idea of what nutrition I was putting in. And
Yeah.
so when my wife and I went to Costco and I cook a lot of Asian food. She ended up looking at a bag of sweet potatoes and she's like, hey, these are pretty good nutritious. Like we should just start trying this. I was like, yeah, at a point I was like, yeah, I know. Let's just check it out. And I've had sweet potato fries. I've obviously eaten sweet potatoes in my life, but I never really cooked with it. And so I started making sweet potatoes and I'm on like a sweet potato kick right now. They're so delicious. I just,
They are really good.
I poke some holes. I put in the air fryer for 30 minutes and
Ooh.
it's so easy. Granted, my other Oma could be an air fryer because I literally
Yeah.
cook everything in it now, which I've been using for a while. So my Oma today is sweet potatoes because they are so good. I made oyakodon yesterday, and people are gonna hate me for
Oh.
this. It's a common thing I like to make just because it's so easy. But instead of rice, I use sweet potatoes because I was like, just
Oh.
giving it a shot. I wanted to make some. I wanted to play around with it. It was delicious.
Yeah.
So
Oh, that sounds so good.
yeah, I
I
know.
am inspired to cook with more sweet potatoes now in my air fryer. Okay, great. Oh, so my Oma is honestly, I've been living in the infrared sauna recently.
Oh,
I
what is an
It's
infrared
so
sauna?
nice. So they use infrared lights to heat the sauna
Okay.
instead of using dry heat. The heat penetrates deeper.
Okay.
And studies have shown, one small study showed that if you sit in the infrared sauna 20 minutes, 3 to 4 times a week, it helps you lose weight. It helps with pain management, arthritis, and it, a myriad of other benefits. So I really enjoy my time in there. They have a TV in the room, so I watch my Netflix shows. So it's like a really nice alone time.
Oh, that's really cool. I gotta check it
Yeah.
out. Right now, obviously, it's it sounds like a very LA thing.
Yeah.
But I'm also from Florida, so I can't really say anything anymore. Geez, from
Yeah.
Florida, that sounds terrible.
Yes.
Uh,
Oh.
yeah, I'll
What
look
is
and see if
that?
they have that. Yeah, I'll see if they even have that where I am.
You should.
Infrared
It
saunas.
feels
Okay.
really good. You just I feel like magic when you get out.
Hmm. What's your sarcoma?
Ugh, I have a couple.
Okay, let's hear it. Spitfire it.
All right. LA traffic. It's I didn't know, and now I know, and I get a lot of stuff delivered to my house now to avoid driving. It's so bad.
Worth the money,
Um,
right? I can imagine.
yeah, absolutely.
Jeez.
And then I guess I think I touched on it a little bit of why I became a content creator and the well-meaning pet parent influencers
Mm.
that talk about raw diets of raw chicken feed and feeding, and that it's more important to feed your pets that instead of, oh, whole and complete diet. So
Yeah.
that's a
I'm
huge,
I'm glad you brought that up because I actually wanted to ask about it.
yeah.
Tell me about this because you mentioned diet. We obviously talk about maintenance and well-being with holistic medicine. So, of
Mhm.
course, what we intake with our food, especially with the herbs and roots that we give in holistic medicine, give me your rundown on diet and your philosophy behind that.
Oh, yeah. I am a big believer if you can afford it, fresh food is the best
Mm,
way to go. Because if you think about it, kibble and canned food, they're great diets. They're whole and complete. They're made by veterinary nutritionists, most brand.
mhm,
Um, but at the end of the day, it's processed food. So it's if we're eating processed food all the time. It's good, it's okay for you, but it's not the best.
mhm.
Fresh food's better because it's fresh frozen and the nutrients are more bioavailable and it's not as heavily processed. It's not a lot of extra additives in the food. And then the raw diet, I'm for as long as there is a kill step because some of my patients can't
Mm,
eat, my really sensitive patients can't eat carbohydrates. So they need to eat something like a raw diet to
mm.
help with their food sensitivities. If you're going to feed raw, just flash cook it. It's something. Kill the
Do something.
pathogens in it for me.
Don't just hunt it and then just shove it into their face. Okay.
Yeah, exactly.
Okay. Do you think there's a nutritional benefit to raw foods? Or when you say you're supportive of it, I also want you to clarify just because the way we've learned, a
Yeah,
lot of veterinarians can be very picky about this, right?
yeah,
The issues that I see on social media with those influencers who are pro raw is they'll argue health benefits and all these things. Whereas, in my opinion, whenever I see raw, it's more so because of their inability to take it's a kind of an alternative choice because they can't have certain foods versus it being more nutritious.
yeah, that's a good point. So with raw and fresh frozen, there is more bioavailability for the nutrients because it hasn't been so heavily processed
Mhm.
through high heat and dehydration methods
Okay.
and being formed into a paste or the shreds.
Okay.
But as far as it being the 100%, this is the only thing, best thing to feed, no. There's so many good kibbles and canned food out there that you can feed
Okay.
your pet that they'll do just fine on.
Okay.
But
Well,
I think it comes down to preference,
okay.
honestly.
Good to learn, and thanks for correcting me on that, or at least giving me insight on that. Because
Yeah.
again, my diet and holistic background is not going to be as great. Okay.
Oh, no problem.
Yeah, but
Thanks for
I
asking.
that's a great sarcoma. Now circling full circle back to that
Yeah.
because it's triggering because a lot of the
It
times
is.
when they post those things, it's also very aggressive, and they purposely do
Yes.
it because it's sexy and it's like provocative. So yeah, I get you.
Yeah. Yeah, totally. It's so bad out there.
Okay. Any, not that we have any sponsors, but any brands that you'd recommend in terms of like fresh frozen or anything like that?
Yeah. I really like Just Food for Dogs
Mm,
because they can ship nationwide.
yeah,
My
super
dog's
common.
on
I
it.
totally win. Okay.
It's really easy for pet parents and to have access to it. I like farmer's dog.
It's another one that's pretty popular. Yeah. Okay.
Hmm.
Cool. The two big
Yeah,
ones.
those are
Okay.
the two
Okay.
big ones. I like Just Food for Dogs a little bit more because they did an actual clinical trial on their food, so there's science backing that their
Mhm.
diet is works. But Farmer's Dog also has a veterinary nutritionist
Yeah.
behind it.
Hmm.
If you're leaning raw, I would recommend Stella and Chewy,
Okay.
Instinct, or Darwin's because they do kill stuff, and there's a veterinary nutritionist or an animal nutritionist with a PhD creating the diet. That you
Okay.
know you're getting a whole and complete diet, and you're just not feeding butcher meat.
Great to know. Thank you. All right.
Yeah, of course.
Any more sarcomas?
No, not
No?
not
Okay.
today.
Okay. Well, thank you for that. Yeah, so you mentioned your location and the traffic, and this is always a cop-out sarcoma, but now that summer or spring is coming back into Florida, I was
Hmm.
enjoying like the high 60s, mid 70s for a couple of months. We're now back into the
Mm.
crazy humidity 80s and 90s, and it is
Oh,
stupid hot. My air conditioning is
yeah.
just running 24/7. It gets overworked, so by the time it's nighttime, it does not push out enough. It hasn't had any
Oh my
rest, so it
gosh.
gets warm at night. It's
Um,
pretty rough. I can't go out there without having an immediate like sweat bomb hitting me. So
oh, there's your
that's
infrared sauna.
I know, right? Yeah.
You live in
There it
one.
is. I don't need one. Come on. Jeez.
Yeah.
Move to Florida. I get it for free. But yeah. All right, guys. Hey, that'll do it for today's podcast. Again, thank you so much, Dr. Kat Van Zant, for coming on. Hope to have you
Thank
on for
you.
more episodes. You got some great information. I really hope the best for your business, your presence here. Be sure to be on the
Yeah.
lookout, guys, because we got some good content coming out for the new creator. Huh?
Yeah. Thank you so much for having me. It's been a
Of course.
pleasure, and I always love chatting with you, so it's been
It's
great.
always a good time.
Yeah.
All right, guys. Take care.